Um, adding passive activating forces to the hip. The process is the same. You're targeting more of the desired motion and then adding an activating force to see if it gives you more of that desired motion with greater ease. So you're going direct, you're trying to go into the restriction. You add the activating force, see if it helps. If it doesn't help, you try another one, and then you can combine them after you've tested them. You just want to be organized. So compression, distraction, torsion, shear, squishy, pulley, twisty, slidey, right? Whichever words you like, or you can use other ones because you probably know more languages than me. Anyways, just a quick test of this one because it's here, right? So there we go. Well, this is not a test of the hip. This is a test of the limb and primarily the posterior chain. So this one needs help. This one needs help. Okay. So I'll just test real quick down here. That's good. That's good enough. Not bad. Better, right? So this is the hip that's giving you a little trouble. It was a complete accident. I didn't mean it. We didn't talk before. So now if this... No, not at all. I'm acknowledging that it was an accident, right? So, okay, posterior chain. Right now, if I'm thinking about the hip, I can try to target the hip. This may do nothing to the straight leg raise, but it may do something a little bit more to the adduction, okay? So as far as options here, no, that's the wrong shoe. So I'm gonna show something that I saw in the room, which was awesome. Kendra, once again, right here, now I have more hands. I have more hands to do interesting things. A lot of this is going to be body. If I'm trying to create the traction, I have to control the shin or the relationship between the leg and the thigh. So here, now if I'm holding here, depending on how I do this, the knee opens up a little bit. You can see that stuff's happening, but this doesn't feel like good traction, right? Like I'm pulling you, doesn't feel like it's the hip. So for me, under the circumstances, I might like, that feels more hip, right? Okay, so I have to recognize that this move in the setup is a great setup, but the height of me, the size of me, the relationship may not work. And if I lean back without hands, right, so I can hold here and control it. That's really good, right? You like that? Okay. This is a good option. One of the challenges with this is that the ability to tune into smaller movements is tougher because I have to do it over my own foot, over the closed chain of my own foot. So it's a very powerful traction. The compression would actually be pretty good because I just pin it here, right? That is pretty good compression. But the ability to have the smaller movements in other planes and axes is tougher. So it's a trade-off. Very powerful, really good move. I'm just gonna put my shoe back on. That's one of the reasons that I tell you I constantly don't tie my shoes. That's literally one of the reasons. Some of it's just, I don't want to, right? So same idea, okay? So just to describe the hold, because it's not gonna be visible on the camera, I come underneath, and then the back of my hand is on the lateral side of his thigh, okay? Then I can grab this wrist. Now I have more of the minor movements. Not perfectly, because the table gets in my way for the external rotation. It is a challenge, but my ability to create targeted traction, pretty good, right? Targeted compression, pretty good, right? So if we're gonna think a little bit more about hip flexion, to make sure it's what I'm targeting, the other one isn't great for hip flexion, but it's really good for traction. So I can find a little bit of hip flexion bind there. So that's about bind. It doesn't mean that it's in the same place that we felt with the straight leg raise, but it's something. Okay, so I'm gonna try to compress, and a little bit more is easy, right? And I wanna compare that, I wanna make sure traction, even easier, right? Like actually?
Yeah, you're going further. I'm trying to distinguish if you're actually lifting, so my pelvis.
Your pelvis is definitely gonna come off the table.
Okay.
I can't stop it unless I do this.
Yeah.
Right? And then I actually lose control.
Yeah.
So it is a blunt instrument to some degree. So the traction, there you go. Add this in, yeah, add this in, not as good. So it's traction and that. Like we're moving pretty far, you feel good about this, right?
Yeah.
Yep. Right, so it's finding the path that he'll actually respond to. So I've got some traction, I've got some internal rotation, and I've got more flexion out of it. Whereas if I just do this, he's going to start to shoot off. Like he's gonna come off axis. We've got bind. You agree? Okay. So here, it's more flexion. This is getting closer. All right. Now, yep, please.
If you want that change to stick, how do you just sit there, or like what's happening?
It's hard to know. So the way that I generally explain it is, how do you know when you're done? Part of it is internally. When you feel like giving up, just retest. Some people will claim honestly that they feel the release. Others will not. I don't feel it give, it let go. I don't feel the release. I tend to say, I've had enough of this. I'll retest it. If it's done, it's done. If it's not, I'll do something else. Okay. Is it the perfect move for the problem? No. But it does the trick under the circumstances and demonstrates how you go about choosing which activating force is working. You know the goal. You add and you test. You see what that's like. You try the other one. You add that and you test. Whichever one's better, go there. Add another one. So in this case, it's the twisty. I can't really do any form of shearing or side bending just because of the hold. Not because it's not possible, but because of the hold I chose. Right? So I can do it longer lever. I can do stuff like this. So I can bring it in here, right? Be nice and tight to it here, right? Traction and more. Cool. Right, now the problem here, the reason it's not working is because the knee's bending. Okay, that's why I don't like it. Whereas if I traction it, turn it here, I get more and the knee doesn't bend. I'm on a pretty firm barrier, you agree? Yeah. I can probably go further, but like I'm also paying attention to this. Because the knee's gonna bend. If I go further, like it's just gonna fight a bit more and I don't want it to. So here, so you see how it's the same concept? I want more flexion. I try with compression, I try with distraction. Try with internal rotation. I didn't try with external rotation, so I'm sort of lying to you. Right? Really, I should also do this, and see how it bends? Okay. Here, here, here. Now, to juice this up, I could go patient active, but I won't, just to see what the heck this does. Right, so we see I got a result. How do I know if it's done? I test it. Is it as much as I would want? Now I retest it. That may have done literally nothing, or it may have made it better. So how do I know? It was the retest. It was a retest. But the process was the same despite the hold being different, right? Yeah?